Mackenzie, you are a multiple mast cell tumor dog that I love. I've been taking care of you for years. You've had way too many mast cell tumors, and your spleen was a little bit big, so we aspirated it today. Yep, we're gonna make sure your mast cell tumor isn't spread. And what did I find on your exam? Let's show everybody what we found on your exam. It's gross. You're not gross, but what I found is gross. It's not your fault. It's not your fault, Mackenzie. There it goes. I thought I found another skin mass, Mackenzie, but no. I thought I found another skin tumor, so that's better, right?
We gotta be on tick duty. You wanna do tick? You like tick duty?
Do you like ticks?
I've never taken off ticks. Well, yes, I have. I've taken off plenty ticks.
I don't like ticks. I did not become an oncologist to play with ticks.
It's like pimping.
It's like pimping?
Pimping. It's like pimping.
That's a whole different vlog, sweetie. All right, day is over. Kind of got away from me. Let's see. So today I had beautiful Callen. Oh my God, Callen, you are so beautiful. How are you?
Great.
Besides the skin?
Great.
Skin's better on Cytopoint? Good. Callen is our Irish setter that has anal sac tumor, got his second dose of chemo. Interestingly, the thing that really bothered him between his first treatment and today was his skin, because we had to stop a skin medication called Apoquel. And so we put him on a newer one called Cytopoint, which is a little bit safer when they have cancer, and he got a second dose of chemo. So mom was really, really worried because if his skin is not doing well, his quality of life is not going to be good. So I have to keep his cancer under control, and I'm working with his vet, Dr. Kanat, to make sure that we get his skin under control. Woobie, did you have a good ultrasound? Woobie, you're 2 years out. Woobie. Woobie, a cute little dog. So this is a patient of mine from Wappinger Falls, and 2-year anniversary, thyroid carcinoma in remission. So super, super excited. Today we did his ultrasound, was in remission, and yesterday we did his chest x-rays and blood work and thyroid levels. So all is good there. Let's go tell your dad the good news.
We're gonna tell him good news? Are we gonna tell him good news?
Good news. Oh, he loves you. Let me do one more. How are you, Bon Jovi? Do you give love a bad name? Are you wanted, dead or alive? Alright. I can't help myself. Alright, so this beautiful dog has oral melanoma, the most common malignant tumor. Let's show him where he was. So he had a beautiful scar revision surgery to get margins. You can barely see, but it looks so good. Let's see the inside. Let me see. Oh, it looks good, buddy. Looks great. All right, so you can get your 3rd of 4 melanoma vaccines.
Nice, almost there.
Yeah, and then then you get the boosters every 6 months. All right? All right, Jen's gonna drop your vaccine.
Oh boy, bud.
All right, you hang tight. Look who's here. This is Frodo, everybody. You may remember Frodo. So we've been taking care of him since November of 2016, right? It's 2018. Yeah, so almost 2 years. He had a high-grade mast cell tumor on his face that went from here, sort of like up to the canthus of his eye. It was bleeding, it was oozing. Been on a bunch of chemo. We made the tumor go into remission, one some Palladia, and then he relapsed, and then we used a bunch of other chemo, and it went away again, and now it recently came back, and we put him on oral Leukeran, and this mass went away, which we saw at our last appointment, but now it looks like he has a couple other lesions sort of running along his lower gum here. Let's measure one. About 2.2 centimeters. So he's going to actually see our radiation oncologist today, and we're going to see if we can give you a little bit of radiation to get your mast cell tumor better under control. But hey guys, high-grade mast cell tumor out almost 2 years. And he's pretty freaking cute, right? Pretty much. Pretty much. All right, let's see what your blood work looks like, mister. And then who gets to hold you today? Maybe Steph. See, Frodo can't go in a cage. Frodo, what you doing? Your blood work looks good. Just hanging out with Steph? Yep. For old time's sake? What happens if we put you down, Frodo?
We bark and we don't like it.
No, you're so handsome. All right, Frodo. Your mast cell tumor is stable-ish, so we're just gonna go with it. Splash your radiation? Be like new in no time. I love you. All right, Pokey. You're still in remission. You're on maintenance chemo, and you're doing great. You are. We're gonna check your lymphoma blood test. See how your markers are doing. You got a little vincristine today, a little cyclophosphamide, and then Steph just nicely took you for a walk. She took you for a walk. because cyclophosphamide is very irritating to your bladder. So we take you for a walk after we give you Lasix. And then we get all that acrolein. Do you know what acrolein is? That's the breakdown product. That is the breakdown product of cyclophosphamide. And if we let it get in your bladder, it's irritating. So that Lasix makes you pee. So Stephanie took you for a walk. Yeah, all right. You're on every other day pred, so you're on a protocol called maintenance cop. What do you think about it? You know, I love you. So it was a good day. I've had some celebration. I am out, guys. I will be back in about a week. I'm off to AVMA in Denver, so we'll try to film some of that. But thanks for joining, and gonna get out of here and go see my kids.